won't only benefit Quebecers in every region, but they will also put people back to work.
Premier François Legault says the daily COVID-19 numbers continue to show that Quebec is going in the right direction and the province has to concentrate on phase 2, kickstarting the economy. With that, a push to pass Bill 61, aiming to fast-track infrastructure projects in Quebec, accelerating the construction of schools, seniors' homes, roads and public transit systems. If passed, the bill could allow some projects to skip irregular procedures, a major concern for opposition parties who say they won't vote for it.
We would like to know if the three party of opposition, if they agree or not on the principle. We have until tomorrow to know that and then work to have a better project. So we've heard the concerns from the opposition parties, and we ensure some of that this morning with important modification to the Bill 61.
Seniors' homes remain the hardest hit by COVID-19, with 278 CHSLDs still seeing COVID-19 infections. Training for 10,000 orderlies begins June 15th, with the goal to have workers in place by September 15th. But the Premier knows that until then, things will remain difficult, and he's asking Ottawa to increase Canadian military within the residences.
On May the 21, we had 1,320 soldiers in Quebec in our long-term care facilities. Today, we have 400 in our long-term care facilities and 350 doing some supervision. And we don't have any guarantee that even those one will be able to keep them until September 15.
5,105 people have died of COVID-19 in Quebec since the start of the pandemic. The province with 53,485 confirmed cases of the virus, 871 people in hospital, and 114 of those in ICU. Public Health Director Dr. Horatio Arruda saying that with less cases of the virus, testing has dropped. The last time the province's goal of 14,000 tests per day was met was May 28th. Public Health now looking to rework the current mobile testing model we've seen on the streets across the city. When it comes to the collection of race-based data, Arruda admitting it's sensitive.
The issue of collecting information about race is always a sensitive one because of different effects of discrimination, but I think there's going to be probably some studies done specifically on those populations to understand what are the factors that makes them having more the disease.
In Montreal, Iman Kassam, City News.